Understanding fluid output, a bladder health guide. Imagine your body as a busy factory that constantly filters and processes fluids to keep everything running smoothly. Your kidneys act like the factory's filtration system, removing waste and excess water from your blood to produce urine. This urine is stored in your bladder, a muscular hollow organ that acts like a storage tank. A healthy bladder can hold about 300 to 500 milliliters of urine, which is roughly a pint. Most people start feeling the urge to go when the bladder contains around 100 to 300 milliliters. On average, adults urinate about 4 to 6 times a day, producing between 800 and 1,000 milliliters of urine daily. The exact amount depends on how much fluids you drink, your activity level, and other factors. When you decide to urinate, your body follows a coordinated process. The muscles in your bladder, called the detrusor muscles, contract to push urine out. At the same time, the muscles around your urethra relax, allowing urine to flow out. This process is controlled by nerves that send signals to your brain, letting you know when it's time to go. A healthy bladder stores urine at low pressure without discomfort and empties completely with a strong, steady flow. There should be no pain or blood during urination, and the process should feel smooth and controlled. Understanding your fluid output is important because changes in urination habits can signal health issues. For example, if you find yourself urinating very frequently with small amounts, or if you feel like your bladder isn't emptying fully, these could be signs of bladder problems or infections. Monitoring how much and how often you urinate helps catch potential issues early. Normal urine output for an adult is about 0.5 to 1 milliliter per kilogram of body weight per hour. For most men, this means roughly 35 to 70 milliliters each hour. If your output drops significantly, it might suggest dehydration or kidney problems. Conversely, if you urinate excessively, it could be related to other health conditions like diabetes. To keep your bladder healthy, it's important to stay well hydrated but not overdo it. Drinking enough water helps your kidneys do their job without overloading your bladder. Paying attention to your usual voiding patterns and volumes can help you notice changes that might need medical attention. If you experience symptoms like frequent urination, urgency, pain, blood in your urine, or feeling like your bladder isn't emptying fully, it's best to consult a healthcare professional. They can evaluate your symptoms and recommend appropriate tests or treatments. Bladder training programs, often guided by healthcare providers, can help improve bladder control. These programs may involve gradually increasing the time between urinations or strengthening your pelvic muscles. Such strategies can be especially helpful for managing bladder issues or reducing urinary frequency. From a bladder health and bladder cancer perspective, paying close attention to your urination habits is vital. Changes in how often or how much you urinate can be early signs of bladder problems, including malignancies. Regular checkups and prompt medical evaluation of unusual symptoms can lead to early diagnosis and better outcomes. In summary, fluid output reflects how well your kidneys filter waste and how your bladder stores and releases urine. Maintaining a proper fluid balance and healthy bladder habits supports overall bladder health. It also helps in early detection of potential problems, including bladder disease and cancer. Remember, everyone's body is different, so if you notice anything unusual, always seek personalized advice from a healthcare professional.